Welcome back to Daniyal Ultrasound Clinic, Dr. Munir Obasi. Today we have got a female patient who is complaining of vaginal bleeding. There is a history of amenorrhea for 4 months. So let us see what comes out. Here I have taken a picture. If you could diagnose this one. This is a pelvic pathology. There is time for you for 3 seconds. Well, let's go to the real time. Here is the real time ultrasound. Here we see the uterus, which is enlarged, showing these cystic spaces. Now think for a moment, what could it be? Okay, this is a molar pregnancy or hydatidiform mole. This is a trophoblastic disease and characterized by abnormal proliferation of trophoblastic tissue with swollen cystic chorionic villi. Sometimes it looks like a sponge filling the entire uterine cavity. So in this ultrasound, here ultrasound findings show that there is a partial mole. There are two types, partial and complete. In complete mole, uterus is enlarged, showing heterogeneous mass filling the endometrial cavity. The classic appearance is like a sinuostorm or a cluster of grapes. They look like due to multiple small cystic spaces or hydropic villi. They filling the entire uterine cavity sometimes, but here they are filling the partial area. And in complete mole, the gestational sac or the fetus is usually absent, and there's no identifiable embryo or amniotic sac. And ovaries usually show bilateral thecal uterine cysts. They are due to the high HCG levels. And there's increased vascularity on Doppler ultrasound. Now let's come to the partial mole which we are facing now. Here is a partial mole which shows this is the amniotic fluid contained in the gestational sac, a part of placenta. You see here, this is placenta here. Above it, the placenta is showing molar changes. And one more thing, important thing is that it mimics with missed abortion, but it isn't. These are changes which have taken place due to the trophoblastic disease. And another differential diagnosis could be degenerating fibroid, choriocarcinoma if highly vascular and invasive, hemorrhagic products in uterine cavity. Now, the key supporting features in these cases are usually there would be definitely high beta HCG levels, and patient would present with vaginal bleeding like this women, and uterine size is larger than you see. Uterus is almost 15 centimeters in length. So uterus would be enlarged, and patient sometimes complain of hyperemesis gravidum or pre-eclampsia before 20 weeks, but after 20 weeks there won't be any complaints like that. So this is a partial mole showing a part of placenta. Here you see this is placenta. Below it there is amniotic fluid, and above the placenta there is molar. Uh, there are molar changes. So this is partial mole definitely, and no with no evidence of fetus. Here is gestational sac, which is not showing any evidence of fetus. This is the cervical area I'm going to show you. Here is the cervical area of the uterus. Above it, this is urinary bladder, typically. So this is a partial mole. Thank you very much.